On this episode of Candid Conversations with Dr. Kelly, I'm joined by nurse practitioner and fellow podcast host Mandi Dickey. Mandi shares the deeply personal story of her car accident that turned her life upside down and the long road to recovery that followed. From stepping away from her career as a neuro nurse practitioner to returning to work over a year later, her journey is raw, real, and remarkably resilient. With unwavering support from her husband, the man who was behind the wheel that day, Mandi opens up about healing, identity, and how closely her story mirrors the film The Vow. Without further ado, let's get candid. Welcome to another episode of Candid Conversations with Dr. Kelly. I am honored to have the guest on that I do today. She is a nurse practitioner and actually a survivor of concussion. And I'm so excited to get into her story today. And you know how we do it here. I like to let the guests introduce themselves. So, Mandi, will you please introduce yourselves to our listeners?
Absolutely. So again, Mandi Dickey, I'm a nurse practitioner in neurosciences, neurology. I have been in neuroscience to some capacity for about 25 years now. Started off as a nursing assistant, then a nurse, and then now nurse practitioner since 2012. And most of my experience has always been in stroke neurology. I loved stroke. I would eat, breathe, sleep it, and dream about it at night. And I absolutely loved it, loved it. And then I had the opportunity to add on to my experience and get into neurosurgery and was looking forward to that because I'd wanted to see a brain surgery in my entire career. And got the opportunity. I had a job open up in neurosurgery, took the job. A month later, got to see my brain surgery, and it was phenomenal. And then 3 hours later, I was in a car accident and experienced a traumatic brain injury. So I went from my highest high to my lowest low in a matter of hours. And what I thought was going to be something that just kept me out of work for a couple of days ended up being a much longer process because we just passed the 2 year mark and I'm just now getting back to work as a nurse practitioner. So a lot of stuff in the middle there. But in the whole process, I became very passionate about concussion. So as I'm returning back to being a nurse practitioner, it is all about concussion, starting up a concussion clinic, doing everything I can to improve care for others who might be in a similar experience as me.
That is a beautiful summary tied up in a beautiful bow. I'm going to dive into some details for that, but I have been on Mandi's podcast. If you haven't listened to it, you really should, and follow her page, Brain Wellness. And that's the complete name, right? Not
Brain
snippet.
Wellness, the podcast, is the full thing
Okay.
so if you look
Brain
on
Well,
iTunes or whatever it takes you, you have to look for the whole thing. I should
but
have changed
also
that. I'm sorry.
it's okay, but also search for Mandi Dickey. So it is a phenomenal podcast. She has great guests on, very creative and a wonderful perspective from so many different angles, from providers to survivors, advocates. And I enjoy listening. So please tune in and make sure that you do as well. I want to get into the accident. So when I was on, and I can't remember if this was a behind the scenes conversation that we had or if it was actually on our episode, but I mentioned the way that Mandi's accident happened. It was a car accident. She described it. I was thinking about the movie The Vow. So for my rom-com people out there, you know what I'm talking about. But Mandi, you said that was actually not a pleasantry. It was more of a trigger, not exciting to look back on that. But could you, just for reference, listeners, that is what I thought of, but could you describe the accident for listeners?
Yeah, I don't get triggered quite as much anymore, so thank goodness for that. Yeah, but my husband and I were heading out for date night. We didn't have our kids, thank goodness. It was just the two of us, but we were at a stoplight and we thought the light turned green. And looking back, it was the straight light that turned green and the turn light did not. But where they were, it looked like everything had turned green. So we were just turning from the intersection and there was one singular car coming from the other direction. You can see forever at this intersection, but they made no attempt to stop, swerve, no honking, just slammed right into us. And the police suspected that they were going around 70 to 75 miles an hour. So us not going very fast and then going very, very fast, they literally sheared off the front of our vehicle and it hit right in front of the tire on my side. So it was like a movie for a moment because everything was happening really fast, except for me feeling my head going from side to side in the car. Uh, and that part was very much slow motion because I could feel every muscle and every pull that was happening. So yeah, so seeing any kind of movies like The Vow, it was a very romantic movie up until the part that I saw the accident. I'm like, oh, waterworks. Um, so yeah, it took a long time to get to the point where I could watch movies like that again, and some therapy. Um, EMDR is phenomenal for anybody that doesn't know what that is. Eye movement desensitization and retraining, phenomenal for PTSD to get you over those feelings. So it helps to retrain your brain with those memories. And that was absolutely necessary because I couldn't even drive down the road and see an emergency vehicle drive by me for the longest time without having a panic attack.
Oh my goodness. And now through those therapies, doing much better.
Mhm. Mhm.
Ah,
Not
thank
100%,
goodness.
but getting closer every day. Yes.
Still better. Yeah. Well, I'm such a nerd. I have so many questions just from what you just said. So let's start from a clinical aspect. Do you remember like what you were seeing? Like, was there a flash? Was there any moment where you blacked out?
I don't think I blacked out. I asked my husband to, and I don't think I lost consciousness at all. I was looking at the car as they were coming, so I had a little bit of the rotational injury aspect of it because my body was faced one direction and my head was the other, watching that car come at us. My husband tried to swerve the wheel as much as he could to try to match the impact so that it wasn't quite as much of an impact, but they were coming so fast that he just didn't have time to respond. I remember those parts pretty vividly. After that, everything kind of gets really sketchy. There's a lot that I don't remember. We were in the emergency room for several hours after that. I don't remember everything that happened there. I remember bits and pieces of conversations, but I do remember that they never said the word concussion. They did a CT of my head, they did X-rays of everything because I had scrapes and bruises everywhere, but nothing was broken. They just said soft tissue injury and follow up with your primary. And that's all that I was told from the emergency room. So my background in neurology is what got me the follow-up soonest, because I had connections. I knew people. I had colleagues that I had been working with and reached out to one of them and I said, hey, can you check me out? Because I've developed this really bad headache. We got in a car accident. Can you just check and see if I got a concussion? And yeah, I didn't realize my own symptoms at that point. Having been a nurse practitioner forever, I had no idea. When I went to see him, my eyes weren't tracking together. I couldn't stand up and walk very straight. And he asked me if I realized that those things were wrong. And I said, no, I had no idea.
And even with your background, and
Mhm.
so thank goodness for those connections. I mean, I say, being in this field, it's like if you need a doctor, if you need an OT, a PT, nurse practitioner, I've got a question.
Mhm.
It's within a stone's throw, but not everybody has that luxury. So I'm hopping around a little bit here, but what advice would you have for listeners regarding advocating for themselves if they don't have that cell phone connection to a professional? What do you recommend?
Yeah, I always tell people, I'm like, if you don't feel like you're getting the answers that you need, look for them elsewhere. Keep asking, keep asking. If you feel anything goofy after having any kind of injury that may or may not have involved hitting your head or losing consciousness, because you don't have to lose consciousness, you don't actually have to hit your head. If you hit your torso hard enough that your brain sloshes around, you can still get a concussion that way. So a lot of people try to poo-poo those things, and they're like, "Oh no, I'm fine." But check in with people that know you well and see if you really are fine because you might not notice the symptoms yourself, but other people might see it in you. And then again, keep reaching out and finding something else. Just because you're seeing a neurologist doesn't mean you're seeing somebody who knows a lot about concussion, because most neurologists are general neurologists, so they know a little bit about all of the things in neurology, but they don't know a deep amount into all of those things in neurology. So really finding someone who is a concussion specialist will be your best thing ever.
Great advice. I regularly try to advocate so that people who are survivors, people who may know someone, a friend, a loved one, to don't be afraid to get a second opinion or a third or a fourth. Keep asking questions, like Mandi said. And something that I like to share for people is doctors don't know it all. And there's a lot of information in medical school that you have to go through and learn and memorize so that you can become a doctor. But like Mandi said, finding a concussion specialist is your best bet, because even in neurology, like she said, general practice is typically what happens. And even when I meet a doctor, whether it's an ortho or a neurologist, a lot of times they're like, well, why would I send someone to a speech therapist who has a concussion? What can you do? And
Mhm.
so I just think, ooh, we have a lot of work to do and a lot of awareness to raise. So I'm glad that you're speaking to that. When you were going through it, did you feel supported, or was there a professional that you worked with where you really felt like you get it?
My neurologist, who the one I reached out to initially, he was a good friend of mine and someone I had worked with, and then he took care of me as my neurologist. And he always admitted, he said, I don't know everything there is about concussion, but I'm willing to learn with you. So if there's ever anything that you see, just let me know and I'll look it up too. And he did. So he was super open-minded about everything and was always looking for other options. So at like the 6 month mark, when we really hadn't seen any improvement in anything, he said, well, I think it's time to think outside the box because we've tried everything inside the box and it's not working. So he was a huge proponent of trying things outside of our typical OTPT speech structure because I needed something more than just that. And so he was my biggest cheerleader in the whole thing. He's also my supervising physician that I work with now. So, we bonded really well during that recovery period because he and I both became very passionate about making changes because of what we saw work with me.
Full circle there. And now you all work together.
Mhm.
Well, I love providers like that. I am a provider like that, where you gotta, you throw everything, but the kitchen sink at it. Let's grab the kitchen sink and look outside of that. So I'm into, if naturopathic options are going to work for people. Right now, I am really trying to encourage people to consider multiple professionals and not just, I need a doctor, I need a neurologist. Of course, the advocacy about speech therapy, but also chiropractics. Could you speak about your experience with chiropractics?
Yeah. So I went to a regular chiropractor who was also a friend of mine initially, and it was okay, but it didn't really do a ton for me at that time. However, in the last 4 months, I have been working with a neurological chiropractor. So depending on where you are in the world, sometimes they call themselves chiropractic neurologists, functional chiropractors, neurological chiropractors, they're all the same thing. Chiropractors that have done additional training in neurology so that they know specific information to deal with neurological things such as concussion. And working with him has been a game changer. Again, he has been able to identify other little idiosyncrasies that other providers missed. He was really excited about all the things that I had done because he said that I was not as severe as I could have been when he saw me because I've done so many other things up to this point. But there's definitely still some fine tuning because my vision was still not quite tracking. And there was this issue that I had looking up to the left. I would constantly see double and I could not get my eyes to focus up there. And then he had me doing some exercises where I was literally doing like these little complex movements on the other side of my body to calm down my autonomic nervous system and allowed my eyes to focus. And all of a sudden I was seeing one object up in the corner. I'm like, how did you do that? Because it's almost 2 years and I had never done that before. I'm like, I don't know what you did, but that worked. It was amazing. So all these little tricks of again, just different thinking. And I'm not sipping water out of this. This is pomegranate juice actually, because that helps to decrease my autonomic dysfunction so that I can stay regulated and not hit my wall and I can get through tough things. I literally sip on that all day long when I'm at work. So it's
Pomegranate
amazing.
juice.
Yeah. There's a lot of
Ah,
it has vasodilation or yeah, vasodilation effect. So rather than having all the constriction and everything happening with the autonomic nervous system kind of going out of whack, it helps to maintain blood flow through the whole thing so that you get the benefits of like the antioxidants in it too, but it really helps with that blood flow portion of it so you don't get those vasoconstriction effects that you get the wide fluctuations in your blood pressure and everything. So it's kind of cool.
this is
It's
why
a
I love
simple
the
little thing.
podcast. I learn while I get to speak with people. Oh my gosh, pomegranate juice. Well, I'm going to write that down so that I can look into it and recommend it when appropriate.
Yeah,
So, which professional or research or what part of your journey brought you to pomegranate juice?
that was the neurological chiropractor. It was something that he had learned along the way, and he's like, you know what, just try it, see if it works. And I said, fine, I will try anything at this point. So I tried it, and then we went for spring break out of town, and I did not have my pomegranate juice with me, and I was hitting my wall again more that week. And I said, okay, it's real. So I keep my pomegranate juice on me at all times now.
Wow, and you just sip throughout the
Hmm.
day.
Yep.
Amazing. Um,
It's a simple little thing, but it works. Yeah.
yeah, you've blown my mind.
Right.
I really want to look into this. Like I'm focus. Okay. Um, so I want to chat about your wonderful husband. So, your husband was in the accident with you. His symptoms were not as severe. Could you talk about that?
Yeah, so we didn't really even think about his symptoms for a long time. He got up and went to work the next day, but he's had more headaches since that time. And now that I'm actually starting to get a little better, we're noticing his symptoms more because I think he doesn't have to try to tough through them anymore because yeah, he's getting a little break now that I can do more things again. But more headaches for him, more irritability. He also injured his shoulder or re-injured his shoulder, I guess I should say, but never really got any attention for it because with our accident, we only had so much insurance. And he, with as severe as my symptoms were, I needed medical care. So he decided to not pursue anything because he wanted all of that medical money to be able to go to my care. And we expended that pretty quickly because I had a lot of appointments for a long time. So he just kind of put himself on the back burner, unfortunately for that, because now we're trying to deal with the chronic issues that he's got going on. But he definitely had a concussion as well. So if you think that you can get out of something where somebody else in the vehicle was severely injured, you probably have something as well, and you're just not paying attention to it. But it's really easy to kind of minimize your own symptoms if you're the caregiver for somebody else. It gives you something to focus on so that you don't pay attention to your own issues because you're so focused on that other person.
Let's be honest, writing soap notes can be time consuming and exhausting. But with Freed AI Scribe, documentation just got a whole lot easier. Here's how it works. Freed AI uses artificial intelligence to record your sessions and instantly generate accurate professional soap notes. That means more time to focus on your clients and less time stuck doing paperwork. Freed AI is HIPAA compliant, which made it easy to incorporate into my private practice. And it has been a game changer. It saves me time, reduces stress, and best of all, helped me finally get out of the office at a decent hour. If you're ready to simplify your documentation, use my code Dr. Kelly50 for $50 off your first month's subscription. And join me and other SLPs who've made the switch to simplify your soap notes. The link and discount code are in the show notes. Now, back to the episode. And while not fantastic for your husband, I just have to give accolades and flowers and all the good things because when we were on your podcast and we talked about how wonderful your husband has been, like just supporting you and taking the load off of your shoulders. And, when even when you were thinking like, okay, things are getting a little bit better, but then you still needed to slow things down again, and how he's just been just a rock during this time. So it's nice that the care and assessing and whatnot is going to shift to him now that you're getting better. But he was is wonderful, and I just round of applause for him.
Yeah. Yeah, I would not be where I am today without him. The level of support that he gave was amazing. And no, things were not all sunshine and roses the whole time, but he was definitely my rock for the whole thing. And on days when I just needed to cry, he just held me, and it was And there are still those days. And I'm still so grateful that he just stays there and holds me while I cry because he's like, what can I do? And I say, I don't know. And he says, okay. And he just keeps holding me. And so, yeah, there are days that's all I need
Ah, see, Hollywood story right there.
to.
Prince Charming. Okay, I would like to dive into what you noticed. So you talked about, there were some things that you didn't really notice, but being able to just reach out and ask, like, hey, can you check me out? Was there anything that you noticed or found odd after the accident?
I, well, I didn't notice how much my memory was impaired. I didn't realize how much my cognition was impaired. I knew that I had a really bad headache, and that was kind of the only thing. I couldn't really leave my bedroom very well. I needed dark. I needed quiet. So this was in April when the accident happened, and we were coming toward the end of the school year. I had a tough time getting to my kids' activities. I didn't realize for the longest time how bad things were until I did. My husband was actually the first one to notice when I was hitting my wall. So that term that I use, hitting my wall, is when you kind of get to the point where you hit a figurative wall in either cognitively or physically you can't go forward. And it's just as severe as hitting an actual wall because you just have to stop whatever it is that you're doing. That would kick up all of my symptoms and make them so much more severe than they were even at baseline. So, headache, problems with my speech, stumbling over my words, word finding difficulties, slurring my words, everything would go blurry. And it was dramatic how severe it got. And I think that was probably one of the biggest things that surprised me was realizing how much more severe my symptoms could get because they were already pretty bad on a regular basis and how long it took to recover from them. So the more I tried to push through that wall, the longer it took to recover. And we didn't really realize what was happening until my husband saw it. And he literally said my whole demeanor changed. The look in my eyes changed. My eyes kind of looked sunken all of a sudden. I was staring off into space. And then all these symptoms would kind of spiral. And then the headache kicked in. And that's when I realized it wasn't anywhere up until that point. So I had no idea it was even happening. So the fact that something like that can happen and you don't realize it was a really, really big surprise for me. And I guess it shouldn't have been so much of a surprise because I've worked in the stroke world for so long that if you have an issue on the right side of your brain, especially, you don't recognize that things are there. So people lose their judgment, they lose um, the ability to know that they have something wrong with an injury to the right side of their brain, especially with a stroke. I did not interpret that as brain injury, the same thing, but it is the same. So whether it's a traumatic brain injury or a stroke, those are both acquired brain injuries and the symptoms can look very similar. And I just didn't think about that for the longest time.
Wow. I like the analogy hitting the wall. I was going to ask you about that, so I'm glad that
Hmm.
you brought that up. I use the analogy because it helps, well, you're in the medical field, but it helps to have something like an analogy for people to get them to understand. What I use with my patients is the battery. So if you are at, 20%, do you have enough for what would take 60%? No. So there is a way for you to gauge when you need to shift your behaviors. So, of all those symptoms that you mentioned, with memory being more difficult to manage and word finding, it was the headache that had you open up your eyes, but your husband could see it before you could realize.
Hmm.
It's so important to have somebody in your corner who is there to support you. So whether it's a spouse, a life partner, a best friend, somebody that is very vital in recovery.
Yeah.
Um, I want to ask about speech therapy.
Yeah.
So I'm a little biased. Speech therapy is very important. Could you speak to your experience with your speech therapist and what was positive and what speech therapists can do better?
Yeah, the speech therapist, I don't think I would say that there's anything better that they need to do. I think it's what the rest of the team needs to identify. So it wasn't really identified right away that I needed speech therapy. We thought I didn't know, but my provider thought more of my memory issues were related to the headache because the headache was so severe. He thought that once we got that headache under control, that my memory would get better. We got the headache under control, my memory didn't get any better. None of my cognitive issues got better. So then we did the neuropsych testing, and they said, I think you would benefit from some speech therapy for these cognitive issues. And that's when I had another little aha moment. I had worked with speech therapy so much in the hospital on the stroke end of things that I didn't realize that speech therapy worked on cognition. So that was another area that providers can improve on, just understanding what speech therapists do for one. My speech therapist was amazing. We did all sorts of exercises to try to help me understand what I was reading because I have beyond a master's degree, not a physician level, but just as many years of education. And with all of those years of education, I couldn't read more than a sentence or two before I would get lost. So reading an article, reading a journal, reading a book, trying to do anything like that was not possible for fun or for education. And it seemed at that point that all the bridges to my medical knowledge were broken. I couldn't reach anything. I would hear medical terminology and I couldn't remember what it meant. Couldn't remember how to do assessments. And I've taught nursing school, so I've taught people how to do the assessments that I couldn't remember how to do at this point. And so with speech therapy, we worked on all sorts of different exercises to try to improve my memory, different things to, I literally started reading one sentence at a time and trying to summarize that one sentence before I moved on to the next sentence to see if I could remember it, see if I could understand it. So one sentence at a time, trying to remember things, and lots of different little word puzzles. Every week I went home with exercises that I could do to try to help my memory. And honestly, it wasn't until I got to the point where they kind of discharged me from speech therapy because things weren't progressing last year. And she said, at some point, if you could read the book, Improving Your Memory, that will help you. I'm like, well, crap, I can't read. So how am I supposed to read the book, Improving Your Memory? And then it got to the point where I could hear things a little bit better and I could understand what I was hearing better than I could understand what I was reading. But I still couldn't quite follow along with the whole book. The book Improving Your Memory is not on Audible, so I couldn't try to listen to it there. But I found out that if you have a Kindle, the e-readers will actually read to you. It's a very AI voice, but it will read to you, and it highlights the words as you go. It took me 2 months, but this winter I finally got through that book that was recommended by speech therapy because I had the Kindle read it to me and it highlighted the words as I went because I still struggle with almost like a dyslexia. I'll twist letters and words. But as I watched those words getting highlighted and listened to them at the same time, I would stop and take notes. And I remembered. I started remembering what was going on in the book and how to remember things. And I'm so glad that they gave me that recommendation, even though I was discharged from speech therapy. I'm so glad they gave me that recommendation before I was discharged because it was very, very helpful.
Yes. Well, I've written that book down
Mhm.
so I can take a look at it as well. And that is the, downside of insurance where you have to prove, and if you can't, show the gains, then you have to discharge and all the things. But I'm glad that you had a phenomenal experience with speech therapy. It sounds like there were some functional things that were very beneficial for you.
Mhm.
You said something about it made it very difficult to read an article. Excuse me, an article, which I can imagine, journal articles can be very lengthy and complex and graphs and figures and all kinds of things. So I can only imagine the daunting task when you are working on a sentence at a time. With that, that has got to make it difficult to keep up with, your professional life and work. And I saw that on one of your episodes, a guest, well, actually you yourself, talked about how 40% of people who have survived concussion or brain injury are gainfully employed. And so could you speak to your employment journey with this?
Yeah, so I was not able to go back to work right away, clearly. I still kept thinking for the longest time that it was just going to be that next appointment, they were going to give me the okay to get back to work. And they never did for the longest time. uh, short-term disability covered for 12 weeks, and then it was supposed to go to long-term disability at that point. That was a huge battle in itself, but I still couldn't get back to work. At about 10 months in, I was really tired of being a professional patient and having that all that I could do, but I still couldn't relearn the things that I needed to get back to being a nurse practitioner, nor could I really learn anything new. However, by that point, I had been a patient at the clinic where I went to get red light therapy and laser therapy for 4 months. And you know what? These machines are pretty easy to run. All I would need to know is how to program the buttons on there. Otherwise, I've been a patient of this for 4 months. I'm pretty sure I know how to run it at this point. I just need to know the tips on that. And I'm pretty sure I could use little flashcards to remind myself of what settings to use for what thing we're treating. And one of the founders of the company kept joking with me. He's like, you just need to come work with us. You just need to come work with us and be our brain person. So finally one day I said to him, I said, is that a legitimate offer? Like, are you legitimately saying that I should come work with you? And he was like, yeah. So the next day I had my formal interview, and within 24 hours I had a job offer. So I started as a laser technician, nowhere near being a nurse practitioner, but I couldn't just stick in permanent patient mode. And I couldn't work very much. I worked 2 3-hour shifts a week. That is all that I could do. But it was something, and it was getting back into medicine somewhat. My therapist, actually, all OTP speech, they all congratulated me for doing something, because so many people get stuck where they don't want to do anything less than what they were doing before. So they just don't even try because they don't want to, they don't, they're not happy taking anything less than what they had. And I said, well, I just can't be a permanent patient anymore. I need to do something to use my brain. And I need to try to spark something. And as I was working there, every once in a while when I was doing laser on somebody, they would ask about something, and I would get this spark where I could answer a question. So somebody had torn a muscle in their calf, and all of a sudden, out of nowhere, I'm like, oh, that's the gastrocnemius muscle, and it inserts here and it starts here. And I thought, and I stopped and I looked around, and I'm like, where did that come from? Because I have not been able to access that knowledge in so long. And finally, it was back for that split second at least. So in that moment, while I was using that knowledge, the bridge reopened and I was able to think about it. So I would have a few more episodes where that actually worked. By the time last summer came along, I thought, you know what? I just want to see how close I am. So I reached out to my employer and I said, can we try doing like a little 4-hour shadow thing and just see how I'm doing? Am I close to it? And I went, and I failed craptastically, as I like to say, because it was
Craptastic.
craptastically. Because I was hired to work in the hospital. It was a level 1 trauma hospital, and we were doing all of the neuro trauma. And I couldn't handle it. It was too loud. It was too noisy. There was too much going on. I couldn't remember the terminology. So we finally determined that it was time to terminate my position because I was not going to be able to go back anytime soon. And that was kind of hard on my mental health again for a hot minute there. But then I started having conversations with my neurologist. I said, I feel like I've been called to do something with concussion. I just don't know what that looks like yet. And we started brainstorming. And finally, at one point, he said, well, we need a concussion provider. So when you're ready, maybe we can look at that. And this winter, then I was finally starting to be able to remember things, and I was taking notes and reminding myself on the brain anatomy, the spine anatomy, I could actually look at these things and draw them out and remember the words. And so finally we said, okay, let's do it. So we started building the position, building the thoughts on the clinic. And in February, I had my first shift back in orientation as a nurse practitioner again. So still working just 2 days a week. So to kind of get back to that point of the whole gainful employment thing, it's when I did that episode and I talked about all the numbers of people not getting back to work or not getting back to work on a stable level, I would still be considered unstably employed because I'm not full time. I'm not back to the job I was before the accident. It's a different version. So now I'm just in clinic, not in the hospital anymore. And I don't know that hospital will ever be on my agenda again because it is so overwhelming. But I definitely feel passionate about it, and I'm glad that I can do something. And we're working with the goal of getting me back to full time, but I don't know what that'll look like yet either.
Well, as a speech therapist, I'm always excited for people's gains, and that is a huge one.
Hmm.
And I love that you did do something with your brain. And so, working at as the tech, and I want to get into the red light therapy and talk about those benefits as well. But overall, throughout your experience, first of all, just bravo to you for sticking with it and reaching the goal of working as a nurse practitioner again. Um, remove the just, you said just 2 days. No, like that is a huge thing. So be, excited and happy for that. I am for you. But I would love to know how your experience has modified your perspective or helped you become a better provider with patient care that you provide.
Yeah, a modified perspective for sure, because I was stuck in that mentality that I want to get back to where I was. I want to get back to that. And then through all of this, I realized that I was working probably harder than I needed to prior to the accident. I had a full-time job and a couple part-time jobs, and I had my podcast, and I had my kids' activities, and I was training for a marathon. And there was always the and. I didn't know how to rest. I didn't know how to be still. So I had no idea how to listen to my body at that point. And through all of this, I realized that, you know what? I don't want to get back to that. I don't think I ever want to be that busy again. I wanted to get back to being a nurse practitioner. And I have come to the acceptance that it might be a different setting than it was before. It's still a nurse practitioner, but it's a different setting. And while it's a different passion. It's not a different field. It's still neurology because I had to go back to something that I knew. I couldn't go back to the neurosurgery because I had to learn things in order to do that, and I can't learn that many things. But right now, right now.
I always
But
say right now for my
yes.
patients. Yes, right now. Thank you. I'm thinking it right now.
So I am where I am right now. And will this be where I am forever? I don't know. But right now, it meets my needs. And I am so glad to be back. When I saw my first patient in clinic after I was done with orientation, I was like dancing in the hallways. And I looked at my doctor again and I said, you know what? It feels good, really good to feel like a human again. And we did a little fist bump in the hallway. And it was just that act of being able to see somebody and actually listen to them. So I get to build my own schedule. So I have an hour and a half appointment for my consults. So it gives me plenty of time to really get a thorough background on them, get a good exam, and come up with a really good holistic plan for them, not just the PTOT speech and not just anything about speech. So don't take that part wrong.
None
Uh,
taken.
but it's that's those are amazing therapies, but that's not 100% of what people need, and it's not going to get everybody better. So when to kind of bridge to the next thing, the red light therapy, when I started adding that in, we saw the gains in PT, OT, and speech. I started improving it. All of my therapists were like, "What are you doing differently?" Well, I was getting red light therapy, and that's what helped. So I needed to look outside the box. I needed to get that toolbox bigger and look at other things that could boost and augment what I was already doing. Because the therapies are great, but they're not going to fix everything. And not everybody is going to get better at the same rate. So I've learned that as well. And just taking the time to really listen and hear what's going on with my patients. And I did that a lot before, and I've always been the why person. I want to know the why of what's going on. So that's why I research all of these other therapies to see what are they actually doing with my patients and what can they do for my patients, so that I know more. Because I didn't know, I think it was before we hit record, I didn't know about audiology. I didn't know about like hyper
Neurooptometry.
neurooptometry as much. I mean, I did because of my own practice as a patient, but prior to needing it, I didn't know about it. So I didn't know about all of these other things that were out there. So now I can make referrals appropriately. And I also know now, coming up on an episode this week of my show, uh, I'll be talking about hormones a little bit and how hormones are affected by concussion, because the pituitary can get injured, and all of a sudden, all of the hormones that come out of the pituitary, your growth hormone, your sex hormones, your adrenal hormone, all of those can get thrown off. So now you have issues with females with their menstrual cycles. Nobody talks about this before. It was not a thing that I knew. I talked to my women's health nurse practitioner. She didn't know that either. Like, did you know that it can push people into early menopause? No, but because those hormones are all affected, all of these things can cascade. So nobody else is having these conversations with patients because they don't realize those connections are there. But because I've gotten so passionate about this, I'm looking into all these things. I'm educating myself so that when my patient comes into my office, I can give them this whole list of these are the things that we need to work on and when do we need to work on them.
As well as a list of other providers. So yes,
Mhm.
none taken regarding the therapies. I am that therapist who's like, what else can we do thinking outside of the box? I've actually interviewed a um, retired professional boxer, and he is into that neuro space with massage, and he does a program called Square One or SQ1, and it has to do with a series of movements and how you reset the brain naturally. And there's, um, repetitive movements that are done. So I've actually done a session with him, but that's, not what a doctor would prescribe. And, from that to chiropractics to red light therapy, these are all things that I think every provider should be privy to so that, just like you said, you know who to refer
Mhm.
patients to, because PTOT speech is not the holy grail of everything that's going to work for every single person. So having a provider with an open mind is definitely vital.
Mhm.
Could you speak to the red light therapy? So people hear red light therapy. What is it? How does it work? What do you as the patient, like, what is your role in it? What's the therapy like?
Yeah, so red light therapy is kind of the popular term that we use for it. The real term is photobiomodulation, PBM is the abbreviation for that one. So photobiomodulation, when you break down that word, photo is light, bio is change, and bio is life, and modulation is change. So you're changing life through light there, essentially. There are different ways you can do it. You can do the red light therapy through a bed or through a focused laser. So the class 4 lasers also have red light therapy in them as well. And there are multiple different variations of them, but essentially, when you go to a facility and you have the red light therapy in the bed or the laser, they're using specific wavelengths and nanometers of red light to treat specific things. And there are specific wavelengths for brain function. So when you're doing the red light therapy, either in the form of a laser or the bed, as the patient, there's not much you do. You sit there and you get to experience it. The red light beds look like tanning beds, but they don't tan you, and most of them don't get very warm either. But it is essential that you go in your birthday suit, ideally, so that you get the most of the red light. It gets absorbed through your skin. Some of the beds will have higher powers than other. So going to a red light bed at Life Fitness is not the same as going to a red light bed at a medical spa or a medical clinic because there are going to be different grades of red light.
You
And
mentioned class 4.
class 4 laser is a medical grade laser, so there has to be a physician overseeing that practice. So you're not going to be able to get that there. Chiropractic offices can use a class 3 laser because it's not the same level of medical um, functioning with it. They're going to have different purposes. Class 4 is going to get deeper into the tissue than class 3. Class 3 is typically a cold laser, whereas the class 4 gets warm. So a little bit differences in that, but they're going to be used similarly. But class 4 would be definitely a higher power. And some places that you go will have the ability to add green light to the red light. And green light, for the creators of it, the ones that have been doing all the research on it, they say green is the new red. But the green light actually gets at different areas in your brain and your nervous system as well. It latches onto the opioid receptors. So people that have chronic pain can find a lot of relief with the green light because it hits those opioid receptors. It changes the way your body reacts to pain and how it perceives pain. So rather than being in a chronic pain cycle where you get in this thing where your nerves get sensitized and they think that everything is painful, it retrains those nerves so that it's not painful for everything anymore. So that's kind of cool. So it's really helpful for the headache portion of concussion recovery. But the laser, so the red light helps to decrease inflammation in your body, in your brain, your body, wherever it's focused, depending on, again, the wavelengths. The laser, where it's focused, actually helps to increase blood flow into the brain it helps to create new blood vessels. So you get better cerebral blood flow, that blood flow that is required to lubricate and nourish your brain. So in that process, it helps to repair some of those areas that were damaged. There's been research all the way back to the 1940s. So it's been around for a long time. It just hasn't hit mainstream, but it's getting more attention now. But this research has been there forever. And they did research on rodents who had strokes. So it's never a fun way to learn about how the rodents get the strokes because they're forced to have them, but then they treat them with the red light to see how they do. And the rodents that got treated with the red light early in their recovery, they got back to almost 100% of their function. So they recovered from their strokes if they got the red light early, like within 24 hours, I think, of their stroke happening. So the sooner we can get people into things like this, the better their outcome will be. And there's a lot of research for even like post-COVID. So people that are having cognitive issues after COVID, either the infection or the vaccines, they can get better with the red light as well. So there's so many ways that it can improve your brain and make you feel better, look better, function better. Super cool.
It's definitely super cool. And we have mentioned so many different things that are not, what is prescribed on a pad today. And there are definitely more. We touched on neurooptometry. Red light therapy obviously has phenomenal benefits. And now green light therapy, we're learning, is the new red. As well, we haven't touched on this. We don't have time, but, even hyperbaric oxygen chambers, those have great results after injury, chiropractics. So the list goes on and on. We're definitely thinking outside of the box for treatment plans, aid and improve and help in recovery. So thank you so much for sharing that. I have a quick question for all of my fellow speech language pathologists. Are you on the hunt for fun, functional, and diverse therapy materials for both your pediatric and adult clients? Well, let me put you on to something I absolutely love and use in my private practice: Cognishine. If you haven't heard of it yet, Cognishine is a digital platform designed to support speech, language, memory, attention, executive function, and more. It's science-backed, clinically effective, and works beautifully for both teletherapy and in-person sessions. But what really makes Cognishine shine? It's completely customizable. You can tailor exercises to your client's specific needs, whether you're targeting speech sounds, supporting recovery after a concussion, or strengthening cognitive skills post-stroke. It's become a game changer in my sessions, and my clients absolutely love it. So, if you're looking for a tool to elevate your therapy, check out Cognishine and tell them Dr. Kelly sent you. I know you have to go, so we're going to wrap up, but this is a time where I like to do the Kandid questionnaire. So we'll go through those questions quickly. Are you ready?
Yes.
Okay. All right. First question is, what's one word your friends would use to describe you?
Determined. Because I even before the accident, I was never one to kind of half, I won't swear, half butt anything. I put my entire self into anything that I do. So determined, definitely.
I agree. I mean, look at all the progress. That is determination. Absolutely. Number 2, if you could instantly master any sport or physical skill, what would it be and why?
Ooh. I was a big time runner before my accident, and I'm trying to get back into it, and it's really a struggle. So if I could instantly master that, it would be amazing because that's where I've always been able to like conquer the world's problems. If I was struggling, I'd go for a run and I was instantly calmer again. So I would love to instantly master that again.
Understandable. And I saw you just got a medal. Was it Earth Day?
I did. I did a half marathon. It was not pretty, but I did. Yeah, I hit my wall at mile 12. So there was that. But my family came out, my kids came to the finish. I was about 4 blocks away and I was struggling. I was getting really emotional with my hit. I get emotional when I hit my wall anyway, but all my kids came back because they all ran it with me. They came back and I literally had 4 of them holding me up until I got right to the finish line and then I was to the finish by myself. So yes.
goosebumps, little teary. That is wonderful. What a moment. And then if you all go and look at her page, she is holding the medal for her completion. I'm so glad that they were there and that they helped you. Okay, next. What's one activity or hobby you find most relaxing or beneficial for your brain?
I love being in nature. So camping, hiking has always been my favorite things. I don't go as long of hikes now, but definitely getting out and just listening to things. I tried going out for a run again the other day. That wasn't fantastic on that one either. But the frogs were chirping down in the swamps next to the where I was running, and I just stopped and I listened for a while because it was just amazing listening to these beautiful sounds in nature. And there's a little bit of a breeze coming through the trees. That's my happy place, being out in the wilderness, in nature, in the middle of trees with nobody around me. That's definitely. I mean, you get a little vitamin D also, but yeah.
Yeah, peace. There is a peace and a stillness with that. So I'm with you
Mhm.
there. Okay, what is the most, or what is the weirdest or most unexpected item in your bag or car right now?
Oh gosh, I'm a neat freak. I don't like to keep a lot of stuff in my car. So I'll say probably my little teeny vacuum that's in my little car kit, I guess, in the back of my car. There's a little vacuum back there.
I'm holding back laughter. I'm like, that's not weird. I have one too, but I too have the OCD neat freak thing. So it's not weird, it's efficient.
I don't think most people I know have a vacuum in their car, so for for them it's probably weird. For me, it's not, but
Yeah, I mean, there's just got to be something about it because I gave one as a gift to one that wasn't really received that. Anyways, I don't think it's weird, but I'll accept it for the question. Last one. What's your go-to guilty pleasure TV show, movie, or song?
Mm, I have become a Marvel Universe freak, so I love Thor is my favorite. Thor Ragnarok is my favorite episode. So if I have to choose, I would watch that same movie over and over every day because I love the music. I love his comedy at the beginning. Um, yeah, it's Thor Ragnarok. Chris Hemsworth, he's my secret boyfriend, and you can tell my husband because he already knows. It's all right.
I'm sure that you are vying for the position. A lot of ladies love the Hemsworths.
Yes.
Well, thank you so much for this candid conversation. I look forward to many more and make sure that you all listen to her podcast. Is there anything that you would like to promote and how let people know how they can find you before we wrap?
Oh, yeah. So I have a wellness brain wellnesssolutions.com, and you can find pretty much everything there. My website, my books, because I did write a book about the first year of my recovery called Welcome Back, a TBI recovery story from provider to patient. So the unique perspective of a provider that turned into a patient. For that first year, at least, that my friends have all told me that I need to write a second version at some point. So when I'm fully back, be a second book. But all of those things can be found on my website. I'm on all the social medias. No, I guess not all of them. TikTok, Facebook, Instagram. But I'm there. Yeah.
Well, please make sure that you go check her out. Mandi, thank you so much for coming on, for being candid and vulnerable. This was amazing.
Thank you, Kelly.
Thank you so much for tuning in to this episode of Candid Conversations with Dr. Kelly. I appreciate you being part of this journey and these powerful conversations around brain health and beyond. If you're loving the podcast and want even more bonus episodes, exclusive Q&As, stories from my professional and personal life, behind the scenes moments, and yes, those bloopers you all love, then I invite you to join my Patreon family, where we always keep it candid. Your membership gives you access to all that bonus content and helps keep this podcast going strong. Plus, every contribution helps support our mission to raise awareness, educate, and empower others about the silent struggles so many face. So head on over to patreon.com/Dr. Kelly to join today. I'd love to have you. Until next time, stay curious, stay compassionate, and as always, keep it candid.